Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Thursday, August 4th. I'm here today with Ed Brubaker, our Living Branches President and CEO. Welcome. Nice to see you again.
Thank you. Good to see you, Alex. I think it's been, since May since we did one of these videos?
It has been quite a while.
So yes, it's hard. Time just flies. It's amazing.
Yeah. Well, let's get into our usual rhythm and let's start with a roundup of where we are with COVID on our campuses. And then I have a quiz for you that should be very fun. So right now we have 4 residents in residential living at Dock Woods who are testing positive, and I believe 2 staff persons. And then at Sadderton, we have 1 residential living resident and I believe 2 staff persons. And then at the Willows, there are no residents testing positive, but 1 staff person is positive.
Okay, so it might have been 2.
It might.
But regardless, it's
not a lot.
Not a lot.
Yeah.
That's right.
And that's down from some of what we've seen before. So it feels pretty good right now. So, all right. So here's my quiz. Is the last time that you and I did a video was May 12th. So would you care to guess how many people, residents and staff at Living Branches, have tested positive since May 12th?
I'm going to go with 88 and a half.
A half? Is that, how did you get to a half?
The half is for me when I had it twice after my Paxlovid rebound.
All right, that's a good guess. It is incorrect.
Okay, what is it?
The number is 147.
Is it really?
Yeah.
I was thinking around 100, but I thought, that seems a little high.
Yeah.
147 since May. Wow.
I was really
Residents
surprised.
and staff.
Residents and staff. The highest number by far have been at Dock Woods,
Right.
because we had both an outbreak in personal care and an outbreak in healthcare during that time period. But yeah, it seems like we've done nothing but COVID for a while, and that might be the reason.
Yeah, that's right.
Yeah. But I guess the good news is, of those people, we haven't really had a lot of cases where people have been significantly ill. And I think that mimics trends that we're seeing in the wider community.
Yeah, generally, although some places hospitalizations are going up. And I was reading an article too, there's still like 400 deaths per day in the United States. And I think they were saying that somewhat on average in a flu season, that might be about average, maybe a little bit high. But the difference is flu season is more concentrated in the wintertime, whereas COVID has become this year-round disease. And so they reflected that if we'd have that many flu-related deaths year-round, we'd probably be doing something about it. But I think because we were so used to a higher rate of disease and death with COVID, that now that it's at these levels, we're like, oh, COVID's gone, right?
Yeah.
And people are already talking like that, but in our industry, it's not. And so that's kind of this challenging, weird spot to be, but it's where we're at.
And I don't get as many questions from residents and family members as I did before during the heart of the pandemic. But one of the questions that I do get, are kind of centered around that idea of why are we still doing this or that?
Right.
Everybody else has stopped. Why can't you?
Right. And I think I get some questions sometimes about the computer at the door and going through that, because that still does take some time and adds time to the entry. Part of it now, we know that temperature maybe never has been a great clue whether you had COVID, certainly not any more than other clues, but it does give a tangible way because there's other diseases and illnesses too that people can bring in. And so looking at that, it's a way to kind of remind people, but how long we'll keep doing that is we'll continue to look at that and evaluate it. But it is a way for us to do those screening checks. I can't even say for certain whether that's something required still. It is still required for regulatory, so that would be a good reason to do it. But that would be the other thing too, that within healthcare and personal care, the regulations really have not changed a whole lot. And so we have more opportunity for influence and change in residential living. And I would say in some way, residential living is certainly not like it was pre-COVID, but the way people behave or act or interact with each other, it is certainly so much different than it was before. And we've kind of taken the tact of, you're in residential living, where at this point in the pandemic, you need to kind of monitor yourself and others just like you would if you lived in the wider community. And so I think that's worked reasonably well. Although, as you said, we've had a fair number of cases in residential living, and that's probably directly related to that reality of what I just said about how we're handling it. But it feels like that's where people are at and want to be treated. And so I think that's a realistic place to be.
Yeah, between the two campuses, we would be at 50 since May in residential living.
Right, and there you have it. Yeah.
Maybe one thing we should just mention is that our coronavirus response team, although it's not meeting as regularly as it did, it does still exist. And in the end of August, the beginning of September, sometime around then, there are some items that we're going to reevaluate that will have impact for residential living residents, including allowing unvaccinated persons into the cafe and bistro.
Right.
That seems to be a hot topic.
Yeah, that's right. And the reason we're evaluating that is, while I still personally believe, and we as an organization still believe, that the vaccine was and is important, and we'll talk in a bit about some things that might be on tap for the fall, that we still believe that. But the reality is that the vaccine does not give you full immunity, that you won't get the disease. And so recognizing that, we feel that that's an appropriate place to look at it. With that said, we did look at it a few weeks ago and said, yes, we want to still evaluate it at some point, but at that point we were having some pretty significant cases, and the case counts in Montgomery and Bucks County were pretty significant too.
Yeah.
And so we said probably not the optimal time to make that change, but there are things like that we want to look at.
Yeah. Well, you alluded to the fall and vaccinations. We've been continuing with our vaccination and booster clinics on campuses every 2 weeks, basically. And we're looking to continue that into the fall.
Right.
But there may be some changes.
Yeah, that's right. And what we've been reading about is maybe an Omicron, 5A or whatever it would be. It's hard to keep track anymore. But the Omicron variant, that the new booster should address that more fully. I don't know that they have a 100% read on that yet, but some things I've read have shown it to be coming maybe in late September or something like that. And so that'll be something I'm sure we'll do a stronger push again with to kind of prepare for the winter. And I know for me personally, I did kind of allude to the fact that in May I had COVID. Fortunately, my symptoms weren't too bad. I did take Paxlovid, and so how much that had to do with symptoms or not, I don't know. But obviously I did need to quarantine, and unfortunately Lucy, my wife, did not get it. But I do plan to get that booster then in September, assuming that's when it comes out. And certainly we'll take a look at it and get out the requisite communication. But, the challenge is it's still around, it still impacts our lives, and the regulations still have not changed. And so in answer to your question that you made earlier, that people say, well, why can't we be like everyone else? And the answer is because we're not like everyone else. And I sometimes don't like that, unique characteristics that I'm different, I'm unique. Well, the reality is we're not as different and unique as we might perceive ourselves to be. But in this particular case, our industry is different and unique in that the regulations are still there. And so, here I have a mask that we in the SSO and we as staff still wear out and about within Living Branches. That is not something I wear in a lot of places outside of here necessarily, but we do it here because of regulation. Theoretically, we might be able to say, well, in residential living, the staff there don't need to, and I know some communities do that. I'm not saying we'll never do that. Right now, we haven't done it because it's a bit of a way that we as staff can be in solidarity with each other. Because the thing I think about a lot is, even though I technically may not need to from a regulatory standpoint, we have staff just recently, of course, this is even more significant at the Willows, where we had a yellow zone because we had 2 staff test positive. Fortunately, the residents did not, so we didn't have to close the facility down tightly. In fact, dining still happened, etc. But our staff needed to wear an N95 mask, not just a surgical mask like this, but an N95 and face shields. That's a challenge to do that every day. And so for me, it's kind of a small thing that we can be in solidarity with each other to say, yes, I may not have to deal with exactly what you deal with on a day-to-day basis on the resident-facing areas in personal care and healthcare, but this is one way that we can be together. Now, if the regulations never change, I'm never going to say that we will never change that kind of approach, because I don't know what the future holds. But that's kind of why we're at where we're at now. Whereas I know of other retirement communities that allow more flexibility for staff in residential living. So again, it's where we're at now. It could change in the future, but that's kind of some of the background for that.
I was driving at Dock Woods the other day, and I noticed something seemed to be missing. So maybe we could talk about something other than COVID for a minute and just give some updates on construction.
Are you referencing a part of a building?
Yes, I am.
That was missing, yeah. Leadership staff at Dock Woods, and also other staff as well, did a great job with reshuffling things and moving residents. Some moved to our Souderton campus, some moved back to their apartments if they were able to, and we got our census down to 54. And I just like to, first of all, maybe look at the camera and say thank you to staff and residents and resident families who really were long suffering during this time of change. It's a hard thing to do, to go through this and get our census down from, we were probably in the high 60s, not at 100% occupancy, and then went down to 54. So it was a big job. Ann Groshans, our project manager, did a great job coordinating things with Todd Detweiler and Dave Zwald and Naomi Hawkins on the Dock Woods campus and others there too. But we got to that point because we needed to empty Country Cottage, our memory care unit in Dock Terrace, because we needed to tear pretty much most of that, if not all of Country Cottage, down to make room for the new building. And so, that's down now, and it looks a little different on that campus. And over the next months, it'll look a lot different, because when you start getting foundations in and floors in and walls and new trusses up, the shape of the building changes pretty dramatically. And this is probably the part of this particular project that will have the most dramatic effect of a change in the building. Because when we go into the other areas, phase 2 and phase 3, it'll kind of be within those wings and within the building.
Yep.
So there won't be as much dramatic outside that you look and say, wow, something's happening there. So it's we're at a new spot there, and it's great to be able to be there. Yeah,
I heard a hilarious story that I think maybe gives a little bit of insight into how much staff care about the little details. I heard from a staff person who was driving down the road and saw a car pulled over, and there was a person who was outside of the car, and they were wearing a blue shirt, uniform shirt from Dock Woods. And so this first staff person pulled over and said, "Do you need any help? What's going on?" And the staff person in the blue shirt was rehoming a frog that had come out of the fish pond at Dock Terrace that had been missed when they sent the koi fish to their new homes. So even the frogs have been carefully cared for throughout this process. That was great.
Great, and hopefully they got all the appropriate permitting, right? So we didn't have to slow down the project.
That's right.
You never know with these kind of things, but there's a lot of details in that. Yeah. At our Sadderton campus, we are, I would say, delayed from what we had hoped to be. We were hoping to get started by October or something of this year. But because of the process to get approvals from the township, and then after that getting approvals from NPDES, which was done over the fall and winter of last year for Dock Woods. So it was still a process we had to go through there, but it was being done while we were getting financing done and board approvals and all that kind of thing. Till we get those approvals done, we're now looking at, I would say, the spring. We haven't nailed down the date yet, but spring of 2023 to get started. So it's a few months later than we had hoped for Souderton, but it's still on the books, and we still want to get started, obviously, when we can, but we're a little bit delayed from what we had hoped to be.
Well, and we received a nice grant to assist with
Yes,
Sadderton
we did.
too, so that's lovely.
Yeah, that was a RACP grant that was worked on very well, I know, by Representative Steve Malagary and also Senator Maria Collette. So they were very instrumental in helping that happen for us.
That's wonderful.
There's still a lot of paperwork we got to fill out. In fact, that reminds me, I have some follow-up I need to do on that. But there's that is very good news.
Good. Well, any final thoughts for us?
I would say just a reflection that this has been a challenging 2.5 years, and it's kind of mind-boggling that it's been 2.5 years. And the challenge is that we so desperately want to be beyond this, but it's really hard to do that, right? When it still rears its head and we have to do all the testing and do this. And still every week we're doing twice weekly testing on unvaccinated staff.
Yep.
We just kind of quietly do that. Lori Borglum and her team kind of quietly do that behind the scenes, but it's another thing that we haven't been able to release ourselves of yet.
Mm-hmm.
But in the meantime, we've got multi-million-dollar building projects that we need to attend to, and other planning for the future, and strategic planning, and all this other stuff. And so, there's this challenge of getting back into the things we need to do that maybe were put aside for the last, but also recognizing that some of the things that were taking our time over the last 2.5 years are not gone yet either. And balancing all that, and still needing to wear these around the hallways, and just all those kind of things. It's just, I would reflect, it's kind of, for me, this weird time in some ways, but it's what we've got, right?
Yep.
And so we make the best of it, and our staff and our residents really have been so resilient and done great work throughout this process and in this 2.5 years. But we'll continue to get to where we need to be, but it's an interesting time for sure.
Was that the old Chinese curse? May you live in interesting times.
I don't know if it was or not, but we sure got it.
Yes, we did. Well, thank you so much. Thank you to our viewers. Again, if you have any questions, please feel free to email them to coronavirusquestions@livingbranches.org. And we'll see you again in the future. Thank you.